Hello, my name is Dr. Robert Frenck. I'm a professor of pediatrics in the Division of Infectious Diseases at Cincinnati Children's Hospital. Along with the Tri-State Safety Council, I will be presenting you an overview on the novel coronavirus, also called COVID-19. I am recording this presentation on March 18th, 2020, and am providing you information as we know it as of this date. Initially, I want to give you a brief background about coronaviruses in general. This is a large family of viruses that often are found to arise from animal reservoirs. For example, SARS, a previous coronavirus, was known to come from civet cats. MERS, another coronavirus, comes from camels, and the novel coronavirus appears to come from bats. The typical symptoms of coronavirus include runny nose and nasal congestion, sore throat, sneezing, cough, and maybe a low-grade fever. The virus goes away in 5 to 7 days without any treatment, and the incubation period, which is the time from exposure to symptoms, is about 2 to 5 days. Human coronaviruses are found worldwide and are more common in the winter and spring in temperate climates such as the tri-state area. Coronaviruses are very common, and most children have had a case in their first few years of life. And in fact, by adulthood, over 90% of people have had numerous coronavirus infections. The mode of transmission, which means how the virus is passed, is likely a combination of droplet, direct, and indirect contact spread. Droplet spread means being coughed on or sneezed on. A distance a cough or sneeze may carry is up to 6 feet, hence why social distancing is recommended. Direct spread is through handshaking or someone touching you with the virus on their hands. You then get it on your hand and touch your eyes, nose, or mouth. Indirect contact means that you have touched a contaminated surface and then brought it to your face. So now let's focus on COVID-19. It's a novel coronavirus, which means it has never been in the human population. So people do not have antibodies, and therefore everyone is at risk for being infected. The infection was first detected in Wuhan, China in December 2019, and now has spread to over 90 countries, including the United States. The virus is officially named SARS coronavirus 2, and the disease caused by the virus is called coronavirus disease 2019, or COVID-19. As of March 18th, 2020, worldwide there were over 180,000 confirmed cases and 7,144 deaths, with a case fatality rate of 3.8%. But we must remember that the case fatality rate is based on the case definition of fever, cough, and respiratory distress. As we begin to know more about the infection, we may find that there are many cases that do not meet this original case definition, and therefore our case fatality rate may likely drop. In the United States, there have been 7,038 confirmed and presumptive cases with 97 deaths. And in Ohio, currently we have 88 confirmed cases with 0 deaths. This slide is looking at cases of influenza versus COVID-19. The first 2 columns are looking at flu infections, and the next 2 columns are looking at COVID-19 infections. So in the United States, in this year, we've had between 35 and 50 million cases of flu. And worldwide, it's estimated up to 700 million cases of flu. This has resulted in 20,000 deaths in the United States and approximately 500,000 deaths worldwide. That is not to say that COVID-19 is not a concern, but to date, far more people have died of the flu as compared to COVID-19. Hopefully, it stays that way. This slide discusses transmission of the virus. Like other human coronaviruses, it is thought that COVID-19 transmission is mainly person to person. So between people who are in close contact with one another within about 6 feet, and through respiratory droplets produced when an infected person coughs or sneezes. These droplets then can land in the mouth or nose of people who are nearby or possibly be inhaled into their lungs. This slide discusses the groups at higher risk of developing a severe infection. People over 60 years of age have approximately twofold increased risk of developing a severe infection. Other high-risk groups, including people with chronic medical conditions such as heart, lung, and kidney disease, also appear to be at a higher risk for developing severe infections. So let's now focus on some ways to prepare and protect high-risk groups. We recommend that people stock up on supplies like routine medications and groceries. People have been very effective in stocking up on toilet paper too. Take everyday precautions like washing hands often, disinfecting your home, avoid touching frequently touched surfaces in public, and avoid touching your face, nose, and eyes. Also, avoid crowds and keep away from others who are sick. Now, let's move on to testing for COVID-19. The test is a polymerase chain reaction, or PCR, which looks for pieces of RNA, which is the genetic material of the virus. A positive test indicates that you have the virus. For many viral infections, it is possible to still have a positive test for many days or weeks after infection has resolved. We still are learning how long a person will remain positive for COVID-19 by PCR. This is important because being positive by PCR does not necessarily mean you still are contagious. But to try to minimize spread, if someone tests positive, they will be sent home for 14 days, and the current recommendation is that they will not be allowed to return to work until they've had multiple negative PCR tests. The PCR test is done by collecting samples of secretions from your nose and throat and then tested. It takes approximately 3 to 4 hours to run the test, so results usually are available that day or the next. Currently, I would not be surprised that we will see multiple day delays simply because of the number of tests being ordered and the labs being overrun. Kits are now being distributed to state health labs as well as commercial labs, and some hospitals are developing in-house testing. Blood tests or serology are being developed but currently are not available. This slide discusses the current CDC recommendations for COVID-19 testing. As more tests become available, testing recommendations may change, but the current criteria for testing include having the correct symptoms, including fever, cough, and shortness of breath, having contact with a confirmed COVID-19 case, or correct travel history, or frequency of cases in the community. So the more cases that are in the community, the more likely you have COVID-19. And actually, at one point, you can stop testing because probably people with those symptoms have the infection. And also, we're asking to have people first look for other common causes of similar symptoms, such as the flu, because at this moment, many more cases are caused by the flu than they are caused by COVID-19. So, how can you protect yourself? First, clean your hands often using either soap and water for at least 20 seconds, especially after in a public place, or use hand sanitizer with at least 60% alcohol. To effectively wash your hands, you need to cover all surfaces of your hands and rub them together until they feel dry. A good way to understand if you've washed your hands long enough is to sing the happy birthday song, and when you're done, that's about 20 seconds and you've done an effective hand washing. Also, you should avoid touching your eyes, nose, and mouth with unwashed hands, and avoid close contact. Now, one thing has been a bit controversial is face masks. I know you've seen a lot of people walking around with face masks, but really they do little good. As a doctor, and I'm going in to examine a patient, a mask may be helpful because for about 15 to 20 minutes, they will keep things from coming through the mask. However, after about the 15-20 minutes, the humidity in our breath makes the masks again permeable and does not stop the virus from going through. So one of the things that maybe a mask will do is to remind you not to touch your face, but wearing a mask for a long time in public has little benefit otherwise. So this is a slide that my dog sent to me. Luckily he talks, so he could tell me it's for your own good. You have to stop touching your face. So how do we protect others? First, if you're sick, stay home. Cover coughs and sneezes. Either use a tissue to cover your mouth and nose when you cough or sneeze, and then throw that tissue in the trash. Do not save the tissue to use again. Use a new tissue each time. And then immediately clean your hands to try to rid your hands of any virus. Also, the Academy of Pediatrics teaches children not to sneeze or cough into their elbow, which keeps the particles off of your hand. Also, clean and disinfect regularly, at least daily, high contact items such as phones, keyboards, tables, light switches, countertops, etc. This slide reviews the COVID-19 travel restrictions as of last week. Level 3, which means avoid non-essential travel, the countries are China, Iran, Italy, and South Korea. Level 2, which means enhanced precautions, is in effect for Japan. One other thing is that foreign nationals are not allowed to enter the United States if in China or Iran during the past 14 days. And as we are all, I'm sure, aware, is that we've also put in a travel ban from people coming from Europe. So as my area of research is in vaccines, I am anxiously awaiting a vaccine, but unfortunately, currently none are available. There is a phase 1 trial, which means the very first testing starting in Seattle this week. Depending on the results of that trial, we likely will conduct additional trials in the next few months. However, even at the best case scenario, it'll take 12 to 18 months minimum before a vaccine is available in clinical medicine. Currently, there is no specific treatment, so care is supportive to help relieve and treat symptoms. And if you believe that you've been exposed to COVID-19, please contact your healthcare provider immediately for guidance. So this and the next 3 slides deal with strategies for employers in dealing with COVID-19. Employees with symptoms of acute respiratory illness should stay home until symptom-free for at least 24 hours without the need of medication to stay symptom-free. Ensure the sick leave policies are flexible and consistent with public health guidance, and that employees are aware of these policies. If you have companies providing you contract or temporary employees, ensure that the company that's providing you employees is also following the same guidelines as you. At this time, we would also recommend to not require a healthcare provider's note to validate an employee's respiratory illness. By doing this, that will allow the doctors to have more time to take care of sick people rather than writing notes. And maintain a flexible policy permitting employees to stay home to care for a sick family member, or even for children who are now displaced due to not going to school or daycare. And be aware that employees may need to stay home more often than usual, and there may be a lot of absence. We also recommend to place posters at workplace entrance and other high traffic areas encouraging people to stay home when sick. Teach cough and sneeze etiquette and hand hygiene. Provide tissues and no-touch disposal receptacles for discarding the tissues. And provide soap and water and alcohol-based hand rubs in the workplace. And ensure that adequate supplies of soap, water, alcohol, hand bases, and your tissues are maintained. And then emphasize frequent hand washing, as I mentioned, 20-second duration with either a hand sanitizer or soap and water. And if your hands are visibly dirty, soap and water is preferable to alcohol wipe. Another thing that is very important is to routinely clean all frequently touched surfaces, such as workstations, countertops, doorknobs, and phones. Routine cleaning agents are adequate. In other words, you do not need to go buy special products. Just use your regular products that you have for cleaning, but just do them regularly. And provide disposable wipes, so before use, employees can wipe down surfaces such as keyboards, remote controls, and phones. And that one of the things that's also important is to develop an outbreak response plan. Ensure the plan is flexible. Have your employees help in developing and reviewing the plan, and conduct a dry run of the plan to find out whether the plan has gaps or problems that may need to be corrected. Share the plan with employees and explain that human resources policies, workplace and leave flexibilities, and pay and benefits will be available to them. And share the best practices within the business community. Let's help each other get to the best practices to make everybody as safe as possible. And that the other components of an emergency plan is to explore, if possible, have flexible work sites such as telecommuting and flexible work hours such as staggered shifts. Understand the infrastructure needed to support the work from home. You may need more IT support or notebook computers. And plan how businesses will operate if you have high absenteeism or supply chains are interrupted. And anticipate there will be employee fear, anxiety, rumors, and misinformation, and try to plan accordingly. So to finish, I will go over some myths that I found on the internet. Now, all of these are false, but they are circulating. The first is that there's a vaccine to prevent COVID-19. As I mentioned, we're starting clinical trials. However, at this time, no vaccine exists. This one was amazing to me, that people are saying that you can gargle with bleach, or taking vitamin C or steroids, or using essential oils, salt water, or ethanol is protective. After a hard day work and dealing with COVID-19 all day, a glass of wine might be nice, but otherwise it really has no effect against COVID-19. Another rather distressing thing is that people are saying COVID-19 was deliberately created and or released. There's absolutely no support for that notion. People are also writing that products shipped from China will make a person sick. Again, that is not true. The virus may live a few hours to a day or so off of the body, but on the whole, anything that's shipped is going to take far longer than the virus can survive off it. And the last thing, as I mentioned previously, that face masks will protect you from COVID-19. That's just not true. The exception, as I mentioned previously, is healthcare workers wearing while evaluating a patient. So in conclusion, I'd like to leave you with some resources here that you can gather additional information as you would like. The first page here is guidance from the CDC and guidance for businesses about the coronavirus situation summary and what to do if you're sick with COVID-19. And these slides here, resources here are from the World Health Organization, the Academy of Pediatrics, and information for parents. And the last very helpful site is the Ohio Department of Health, their background on COVID-19. So thank you for your time, and I hope this was helpful to you. Stay safe, use precautions, and we will get through this.